with borderline personality disorder, you're having these fluctuating moods constantly. And again, this hypersensitivity to being slighted or feeling offended, really driven by the fear that if you're offended or slighted, if the therapist comes in 2 minutes late, or if somebody shows up to dinner 2 minutes late, that they might be abandoning you. And it's not as if the borderline is considering themselves abandoned in that moment, but they just know that they have this overwhelming emotion, and there are no attempts to control that emotion. There are no attempts to regulate it. So if they're in the middle of the restaurant and they feel offended, they're going to start the fight. People are going to see it, or they might just start crying or break down, but they'll make a lot of accusations. And that reactivity is when you're gonna see a lot of this escalation in the bizarre behavior. They can react violently, they can react aggressively, they will often physically prevent their partner from trying to leave if their partner wants to get space from all of this intense emotion. And oftentimes they will be abusive to their partners in these situations. Sometimes they'll physically restrain them from leaving and become injured that way, but also people with borderline personality disorder, it seems to be a predictive factor for women who implement violence against their partner. And one of the most common tactics that they'll use is actually physically assaulting and then getting harmed themselves. But mostly, we call this administrative violence. So essentially, this is saying that they'll make threats using the legal system. So they might say that they are going to file a restraining order or claim abuse, or they might do these things to essentially try to keep their partner from leaving. In the moment, again, they're not consciously thinking, I'm going to keep my partner from leaving right now. They're just thinking, I can't stand this. I hate my partner. They went from idealizing to suddenly devaluing because of the hurt, and they'll do anything to express that big emotion of anger. Ms. Heard did not have PTSD, and there were also pretty significant indications that she was grossly exaggerating symptoms of PTSD when asked about them.